Okay. Are we ready to go? Yes, okay. Good evening. Good morning, everyone, and welcome to the Foreign Correspondents Club of Japan. My name is Dennis Normile. I'm a former club president, and I'll be the moderator this morning. We have a small crowd. We've got a number of people watching online, so we are going forward with the event. And we've already gotten some questions from the online viewers. It is a very important topic that we're going to hear about, as I think probably everybody knows that the new U.S. administration has created a lot of upheaval in its interactions with the rest of the world. And one of the biggest casualties so far is the reduction in support for what used to be called, I don't know if it's still called PEPFAR anymore, but the U.S. President's Emergency Plan for AIDS Relief, PEPFAR. It was one of the most successful global health programs in history, reportedly having saved an estimated 26 million lives since 2003. The new administration froze PEPFAR funding, but then partially restored it. And perhaps our speakers might give a little more detail on that. And the question is, can the rest of the world step up and fill the gap in funding for this very important effort? This is very timely because today, tomorrow, and Saturday, taking place here in Tokyo, is the 10th Asia-Pacific AIDS and Co-Infections Conference, where experts in the global fight against AIDS will be wrestling with questions of how to sustain momentum. We're going to hear from three experts, and I'll just briefly give their names as each of them speak. I guess, Joe, you're going first? First, we'll hear from Joseph Tucker. His primary affiliation is with the University of North Carolina at Chapel Hill. He's also co-director of International Diagnostics Center at the London School of Hygiene and Tropical Medicine. And he is a co-chair of the conference that's going on over the next few days. And so with that, I'll ask Joseph to take over.
Can I speak in? Thank you. Thanks, Dennis. Thanks for the opportunity to chat with you today. And we're really at a crossroads. This is a very important time for HIV. And I'm going to speak about three different aspects about the sort of public health implications of the cuts to HIV services, the clinical implications, and then finally, as sort of a friend of Asia and on a human side, what it means to have such major cuts. And these three aspects mirror some of the my main responsibilities. So I'm a professor of global health at the London School, as Dennis mentioned, and I do research. And the APACC conference that's being held this week is really convening world-leading advocates, community members, physicians to talk about the latest research. There are also a number of clinicians, and we're going to hear about the latest clinical research. And there are many advocates and regional leaders. So first of all, in terms of public health impact, the deep cuts that have happened really impact entire populations in Asia. And so PEPFAR services being scaled back in Vietnam, in Indonesia, have huge implications for service delivery, even though these services are being cut back in certain groups. This cascades and ripples out to entire communities and populations. And this is really important. The public health impact of HIV cuts cannot be understated. I'm also a clinical doctor, and I've talked with many clinicians about what's happening in clinics. This week I was speaking with a colleague in Chennai, India, and their transgender clinic was totally shut down. And as a result of this clinic being shut down, patients have to wait longer for tests. The antiretroviral therapy supply is compromised. This will have a substantial impact on clinical services across Asia. And the other part, you've probably heard this story before. You've heard about the cuts. What you may not have heard about is that doctors and communities are really scrambling now to figure out what to do. And it's not too late to help and to band together and sustain some of these services. It's a really urgent moment now to respond, but I think it's important that to realize the PEPFAR cuts that Dennis mentioned, some of these will be permanent, but even now in the United States, the future of PEPFAR is being discussed and debated. And I think it's really important, the huge contributions that PEPFAR has made to public health can't be overstated. I would also like to say that U.S. government cuts aren't just PEPFAR. That it's USAID, it's a number of different organizations and networks that are supporting HIV services. And then finally, as a sort of friend of Asia, I'd like to say a few words. My wife is Asian. I travel to the region 3 or 4 times a year. And I think there's really a moral responsibility to act here. And this is not just about science and research. This is about human lives and deeply important moral issues. And I think all of us have a responsibility. And if we look at the public health issues, the population impact of HIV cuts in Asia will be substantial. If you look clinically at what's happening in clinics, there's still time to act, but there's urgency. And then at a sort of moral human level, I think we must and can do more. Thank you.
Okay, thank you, Joe. Next, we'll hear from Eamonn Murphy. He is the Regional Director of Asia Pacific, Eastern Europe, and Central Asia. That's quite a lot of territory for UNAIDS. Eamonn?
Thanks very much. And thanks very much for the interest. I take the slides won't be used today. The PowerPoint? No? Okay, that's fine. So, but we'll be able to share afterwards a set of slides that'll be used at the APACC conference, and that'll show you some of the specifics of what I'll touch on to follow on from what Joe has been talking about. Because some of us would have said to date that we are now no longer on the path to end AIDS as a public health threat by 2030. And Joe and Daniel both mentioned the dramatic impact of the cuts from the US government, but that's building on reductions in funding from a whole range of traditional donors to global health and HIV and other public interest areas. A whole range of reasons for it: wars, different impacts of economic setbacks, or even COVID in some countries is used as the rationale. But the combined is the significant, and the speed at which things change, with the most recent being the US freeze and now what would increasingly look like permanent cuts to their program. They still remain the largest donor should PEPFAR be reauthorized for AIDS. But as Joe said, it's not just the AIDS program in isolation, it's the other components of public health that are equally critical if we're going to have the impact on communicable diseases and other issues that intersect. When we think of HIV, we've got to think of TB in many of these countries, and we've seen significant cuts to the TB programs. Co-infection, we have the highest rates of TB in the world in this region of Asia Pacific, and equally so this impact is compounded. There's a global strategy. We know what needs to be done. The scientific advancements that Joe mentioned, we'll hear more about at the conference this week, both on treatment, but also on prevention, where today you can get an injection that prevents HIV for 6 months in one injection, and equally treatment for people who used to take multiple pills to 1 pill a day can now take an injection that will last them 6 months. So this is game-changing, but at the same critical moment of trying to get these into the communities in countries across the world, the funding has significantly dropped. So this is a major challenge for all of us. In 2023, estimated 30 million people were on treatment, nearly 31 million people on treatment. This is significant success, including 20 million lives saved. So we have made so many dramatic impacts globally in the fight against AIDS. More than half of new infections have declined since 2010. But we're still a long way from this goal, and this is where the challenge is. There's a 39% reduction globally for HIV infections, but in our region of Asia Pacific it's stalled, and there's a prevention crisis facing us today. 13% only. Asia Pacific used to lead the world in terms of reductions in new infections, but we are way behind now because of this. So to be blunt, we have this prevention crisis with every 2 minutes a new person in Asia Pacific being infected, and this is something that we should be able to prevent. 3 of the world's fastest growing epidemics are in this region. The Philippines, 543% increase. Fiji, 241% increase. And new data that will be released next month will show that that rate is even higher today. And largely, in Fiji's case, the changes have come since COVID. And the impacts you wouldn't imagine of COVID, it stopped the illegal supply of drugs that passed through Fiji and then were provided locally and have blown the epidemic up, which puts the whole Pacific at risk. Papua New Guinea, doubling of new infections. So regional health security, sustainability will be required for this regional partnership to address it. And this is where all partners need to be engaged in this. Domestic governments need to increase their funding, and we have the evidence to show that they have been doing it. There's been a setback since COVID, but it's principally for treatment, and that's the challenge for us. We can't treat our way out of this epidemic. Today, sadly, the data is starting to show us the impact of the cuts, even within 1 year, because of the dramatic amount of funding that has been stopped in a whole range of countries with different types of epidemics. So in 2024, 3,500 people were newly infected with HIV globally every day. Today, that number is 5,800 new infections a day, over a 2,000 new infections a day increase. This is the challenge. This is the reality of what's going to happen if we don't see PEPFAR reauthorized and we don't see those governments that had already been cutting their funding, putting funding back up or at least maintaining levels of funding, and that would include the government of Japan as well. So, as I said, US cuts dominate, but they are still the #1 donor for HIV, but the impact, even with that, is significant. And there's a whole range of European donors and others that we need to see put their commitments back to achieve this. And often with public health threats, we've seen it with malaria, we've seen it with TB, you get a fair way along the track to getting success, and then people move on to other issues, or there's a fatigue, and then the epidemics rise. So we're seeing that just in the first 6 months of this year. So we all have to do this. Joe mentioned PEPFAR's direct implementation, but they were also an integrated partner in many of the countries in Asia Pacific. The big programs that they were supporting here were those programs that are not funded by domestic governments: prevention, the community engagement, the social contracting. How do you bring the partnerships of people who are afraid to go into clinics into the programs so you can prevent HIV and get them into treatment? In Papua New Guinea, programs funded by different partners, the Australian government, the Global Fund, and PEPFAR, are integrated with government services. PEPFAR funded clinicians, so we have clinics operating, services available, but no clinician to provide the most important program there. So this is where the impact has been on other programs that were being funded by other partners as well. This is significantly challenging. It's ironic that we are in this situation in a sense because we were moving with strong US government funding to be looking at the whole issue of sustainability at country level. And that's critical for us going forward. Integration with UHC, which is a high priority for the integrated treatment services, but those other support services around that, particularly prevention and the rights changes that are needed to make these epidemics go. So there's been a 60% drop in funding for the Asia Pacific from 1.4 billion to $600 million in the last 12 years. And that's significant when it's not going to be replaced by domestic resources. Global Fund has already written, sadly, to countries to indicate the impact on the combined reductions that they're facing. So countries in this region are going to receive less from the Global Fund. That was being understood already, and we're working with governments to increase their domestic investments in this region. Countries like France and Australia have also stepped up in this region with investments to help this agenda. This is where we need support from Japan and others to do this. We have great examples, to conclude, we have great examples of success. Malaysia, Thailand, others largely funding their own responses. But others are still very dependent on external support, like Cambodia and Laos. And in other countries, like Philippines, with over 500% increase, they have resources, but it's making the right use of the resources and overcoming the obstacles to implement the programs. And this is a critical area where UNAIDS and other partners have been working with the governments to address this. So just to conclude, Japan has been a global champion in the effort to end this epidemic and other public health threats. They look in a comprehensive public health approach, and its pivotal role in supporting the Global Fund to fight AIDS, tuberculosis and malaria, and to establish that fund, they still remain the 5th largest donor to the fund. And this is something we need to see maintained or increased to compensate for some of the other cuts. Japan has also supported the critical convening work undertaken by UNAIDS, which brings together 11 different UN agencies to work on different aspects of the response. And our work to make the Global Fund function at country level in particular. So we urge Japan and other donor countries not to slow the momentum with the finish line in sight of 2030. Without the sustained investment, this is already being a reverse, and we're going to see the epidemic grow, sadly. Thank you.
Okay, thank you, Eamonn. Finally, we'll hear from Rachel Ong. She is the Regional Coordinator, the Global Fund Advocates Network Asia Pacific. And I think that is based in Singapore, is that right?
I'm based in Singapore.
Yes, over to you.
Thank you. Thank you so much. Ohayou gozaimasu. So I think the speakers have already elaborated a lot around some of the major development issues. I think one of the main things would be what the role of civil society and communities would have in this response. Countries that have relied on aid will face growing pressure to finance their own health systems, accelerating a shift toward local ownership that has been underway for years. Even when we acknowledge that local ownership is the future of public health, the rapid speed on how this is unraveling is posing a huge question. Who is the most impacted at the end of the day, most at risk during this process, and how many lives will we lose along the way? So in the wake of unprecedented cuts in foreign assistance from countries such as the United States, United Kingdom, France, Netherlands, etc., supporting local communities and civil society to be able to advocate for better resources, for greater country ownership and investment in public health is more critical now than ever. I'll elaborate a little bit more further around some of the examples, around some of the country freezes that Joseph has mentioned. So surveys that were conducted by the Asia Pacific Network of People Living with HIV indicated that in Vietnam, while ARV drugs continued to be supplied through domestic funding, prevention programs have completely stalled, including pre-prophylaxis services, disrupting community outreach efforts. In Indonesia, colleagues have seen one of the largest community-run organizations on HIV having to dismiss more than 200 people immediately, impacting more lives and livelihoods. In Myanmar, the suspension of US-funded activities have led to a complete cessation of HIV prevention and treatment services. The International Community of Women Living with HIV in Asia Pacific conducted a survey in 17 countries, which reported women living with HIV facing hardship, widespread job losses, crippling financial hardship, and severe disruptions to HIV-related services, including medications and sexual reproductive health and rights services, leaving women and girls in and across Asia Pacific in severe states of extreme vulnerability. A rapid assessment that was conducted by Youth Lead showed a range of initiatives, including youth-friendly services and clinics, being stopped due to staff layoffs, resulting in unsustainable outreach efforts leading to increased stigma and discrimination, substance use disorders, gaps in social inclusion, and a decline in mental health among young key populations. So as the world becomes increasingly interconnected, the health challenges faced by one country can quickly become global concerns. This was made very clear during the COVID-19 pandemic. Therefore, the cuts to foreign aid not only pose a risk to those within the country, but also increase global vulnerability to disease outbreaks, migration pressures, and overall economic instability. Protecting people's lives mean that people can live longer, which mean a better investment in health can advance economic productivity and broader socio-economic development. The United States is the largest donor in foreign assistance. They have, in 2024, disbursed a total of $56 billion globally in foreign assistance, $32.48 billion managed through USAID. And approximately $7 billion of the United States global foreign aid in 2024 was given to South Asia, Central Asia, and East Asia, as well as Oceania. This is where countries such as Japan can step up and step in to help. However, a substantial increase would be needed to make a difference. The combined aid budgets of countries such as Japan and South Korea was only $22 billion in 2023. According to OECD, which is less than 1/3 of the US $80 billion the United States spent in the same year. Eamonn touched a little bit about the Global Fund to fight AIDS, tuberculosis, and malaria, which is the largest multilateral provider of grants, health grants for lower and middle income countries. It provides 28% of all international financing for HIV, 62% for malaria, and 76% for TB. Since its inception in 2001, Japan has played a critical role as a founding father and a member, introducing infectious diseases to the G8 Kyushu Okinawa Summit in 2000, which paved the way for the establishment of the Global Fund in 2002. Japan has been a strong supporter of the Global Fund, and as Eamonn mentioned, is the fifth largest donor from the fifth largest donor and the largest donor from the Asia and Pacific. To date, it has actually pledged and committed $216.9 billion, and it has prioritized health as an essential basis for people's lives, social stability, and economic development when Japan hosted the G7 in 2023. So I just want to end on the note that government action doesn't happen in a vacuum, and the Global Fund has been an essential leader in its governance and implementation processes, ensuring that policies, programs, and implementation are people-centered with communities and civil society playing a pivotal role alongside other major stakeholders. But we cannot do this work alone. Advocacy requires sustained, targeted investment, financial support, technical expertise, training, and tailored advocacy tools that fit specific political systems and cultural contexts. So as traditional donor governments turn inward, countries will need to step into the leadership vacuum. This shift will only happen if remaining donors step up to protect the investment and progress that have been collectively achieved over the last 20 years in HIV, TB, and malaria. Additionally, more investments in communities and civil society is needed at the country level, because by expanding communities and civil society's capacity, donors such as Japan can help governments fund, implement, and sustain health programs and be able to hold governments accountable for so. So Japan's commitment towards achieving the SDGs, global health solidarity, build sustainable and resilient systems for health, prepare for future pandemics to ensure healthy lives and well-being for all, will ensure a successfully resourced global fund, but also a successfully resourced health response that will support countries to be able to reach achieve the SDGs. So the support is needed now more now than ever.
Okay, thank you, Rachel. We'll move on to questions. Do we have anybody in the audience here who has a question? If not, we have some questions that came from online viewers. One question which also jumped out at me. This comes from Keiko Kurane of UCA News in the Philippines. With the Philippines now facing the fastest growing HIV crisis in the Asia Pacific, what happens to low-income and at-risk communities if global funding like PEPFAR continues to shrink? And do you believe Japan has a moral responsibility to help its neighbor in this public health emergency? Who wants to try that? Okay. Joseph Tucker, please.
Thanks, Keiko, for that really important question. I think your point about low-income individuals and at-risk individuals, these are exactly the people who are most at risk. If you look at where there are cuts, Eamonn just mentioned, Fiji, Papua New Guinea, the Philippines. There are many people who can't afford antiretroviral therapy, and these are the people who are going to be disproportionately left out with the global cuts that are that we've witnessed. So, and I think key populations as well are these kinds of services are essential for a comprehensive HIV strategy, and so these two areas, people who are lower income, people who are at risk, I think we really need to figure out sustainable financing strategies and ways of sustaining services. Is there a moral responsibility? 100%. Yes, there is a moral responsibility to act. This is not about one country and another. This is solidarity, and we owe it to each other to provide services for at-risk individuals, for low-income individuals. So thank you, Keiko, for that really important question. Eamonn, Rachel, anything else to add?
Just to add to that, because the Philippines is a really good example of one of the challenges for us in this region is that the rising numbers, even in countries like Cambodia and Thailand that have been successful, is amongst young people, particularly young men who have sex with men across the region. More than 30% increase is happening. And the Philippines, it had, as the PEPFAR global coordinator used to say, two epidemics. The old epidemic everyone was responding to, and this massive growth amongst young people under 25. And that's where the bulk of these new infections are occurring. So just think about that. We're taking away the critical resources at a time when the epidemic's moving to that new generation across the region. And so that, as Joe mentioned earlier, never stays in one population. Papua New Guinea, we now call it a mixed epidemic. That's because of the rise of infections in the general community, no longer a concentrated epidemic. And it's doubled. There'll be 12,000 new infections this year alone in Papua New Guinea. So how do they deal with that, with the low-level resources? Philippines is the same. As Keiko talks, we need to focus on that sustainability agenda. And this is where Japan's interest in issues like UHC are critical. That partnership, we bring together the other countries from within this region, let alone outside it, who can help the Philippines look at what it needs to do to unlock the money it already has. It's not always about external finances, it's also about their finances. The Philippines has some amazing innovation in service delivery, but it's not at the scale. And that's what we need to help countries. And this is where Japan and others do have a moral and also a self-interest. as Rachel said, we learned from COVID how quickly the impact across the world. So we're going to see this rise again of HIV in populations, and our populations move between countries so easily today. Thanks.
So I'll just add quickly that, but from another perspective, from a different perspective, because Eamonn and Joseph both touched a little bit around sustainability and transition and domestic resource mobilization that's necessary to ensure sustainability in health responses within a country. Any divorce has a separation period. For many of these countries that were receiving large amounts of funding from PEPFAR and other donors, there was no separation period. Aid was completely cut immediately. That left a lot of communities and civil society scrambling, and even governments themselves scrambling. But I do want to add that the way that countries are receiving aid is not actually, does not actually, that there can be better algorithms to be able to determine that, because having a country GDP or GNI at higher levels do not translate to a country's willingness and ability to spend on health. So countries that have the technical expertise and technical partners that do have this expertise should be able to support countries to be able to transition in that sense, or to be able to build better systems for more successful, resilient health responses.
Okay, thank you. I have a related follow-up question for Eamonn. What is going on in the Philippines? I think you said over 500% increase? And this is primarily among the younger generation of men who have sex with men. Is there just a lack of awareness of the risk, or what's happening?
You could step back from the Philippines. I go to many countries, from Russia across to the Pacific Islands. I hear time and time again from young people, HIV, they don't see anything about it. They don't hear about it. And many of our young people today live online, right? So their information sources are online. So we're not getting that. But that's where they meet. I was in Malaysia with a group of state leaders of health across the country, and they were asking why they're having rising numbers amongst MSM. And they're saying, we have more MSM. Men who have sex with men in their country. And they said, no, you just have people who are able to connect now. In the old days, the original epidemic in the Philippines, you'd have to go to a nightclub, a bar, right? And there are a whole range of social barriers to people. But nowadays, you connect online and you meet someone for pleasure, whatever that pleasure is, sex or others, right? And community engagement. So the dynamics have changed. There, the emphasis was on the old stable epidemic, and not where the new epidemic numbers were happening. And it was far too late before they started to recognize it. The resources are in the Philippines. And as Rachel said, the issue is not always looking at some kind of World Bank indicator of resources to make sure you can just step out and leave it. So it's working with them. But it is definitely the young. It's a different way. Young people today are more open about sexuality as well compared to 20 years ago, 30 years ago. So the dynamics are changing across our society. So we just have to catch up to the reality of where people really are, not where we want to have them.
Can I add something to this?
Sure.
Yes. I think having been a young person, the other perspective. Only yesterday. The other perspective is that over 20 years ago, when HIV was, ballooned or exploded across the world, it was very much like COVID-19. People didn't know what to do. People, we were scrambling for treatment. When treatment was introduced in the late 90s, then it became treatable. People started there was a sense of nonchalance about it. It is treatable, but people don't understand that this is a lifelong disease. So it's really much like cancer. It can come back anytime. It can develop or blow into AIDS. It's not, even though it is treatable, there are expenses that governments need to subsidize or step in lifelong for treatment and prevention. So even though it is a treatable disease, it is still very much an expensive one, very much like other non-communicable diseases. So that's from the different perspective.
Sorry, just one last comment on this. The barrier for many of these young people is the stigma and discrimination. If we look at a whole range of countries, Today, the phenomena is late-stage diagnosis. So people coming in with late-stage and advanced illness, which is harder to respond to. So why have they waited? If they know the treatment's available, and many countries provide treatment, they're afraid for other reasons. They'll lose their job, they'll be socially isolated, they're going to suffer a whole range of things. We still see in many of the countries I work with, and not in the advanced economies, but even there, in Singapore, where H was from, the discrimination against someone who comes out with HIV is still stark, and the impact on their lives. So why do they hide? People in our region will even go to another country to get their treatment so that they are not recognised. So this is still a major issue. So that stigma and discrimination and these related programs that need to be emphasised to get people into treatment. TB has some of the same in certain countries, but HIV definitely, and that's a major barrier for young people today. They prefer to come in when they're very sick and deal with it then.
With so many younger people hooking up through their smartphones, doesn't that create an opportunity for intervention? Raising awareness, and there must be programs trying to do that.
Yes, definitely. And you've hit on a really core part of HIV prevention today, that digital strategies, digital strategies are becoming mainstreamed within HIV prevention. It includes things like artificial intelligence, bots. It includes mobile phone applications, the things that people are already using, and the short videos and texts that are on our phones create some exciting opportunities for new interventions. We can also use citizen science to engage larger groups of people. That it used to be community engagement was a small thing done in person, and now I think community engagement related to HIV can be millions of people thinking about an important topic. So I think the digital part, I agree completely that hookup apps and the kind of the current way that young people meet online is certainly a recipe for condomless sex and HIV transmission. But those same social networks and the digital resources and digital lives can be a powerful fulcrum for change as well.
As long as we can add to the information supply that goes out, because information is the first step. But then services. We have great examples in places like Mumbai where you can order your self-test for HIV online. So if you're afraid of somebody else knowing, family or others, you can do it online. We can do the service delivery connections, and we saw that during COVID. Some have slipped back from it, but where you could get your ARVs through an online app delivery, so that you could do it in a whole range of ways. We all use these motorcycle food deliveries. The systems are changing, and we need to invest in that. And that's the sad part. This is where the US was helping countries unlock these opportunities and see how they can use that whole digital space. But there are a whole range, as Joe said, of strategies and programs move that way. It's not the old-fashioned you had to come into the clinic. But information alone through that is not enough. So we need a lot more. Countries are resistant around the self-test modality in places, and then the access to PrEP. Malaysia is a good example. You can get it through a pharmacy. You don't have to go to the clinic if you're trying to protect your identity. So there's a number of ways it can be done. The innovations are there, but we need to resource that innovation to show, and Rachel touched on the community aspect. The biggest impact of these cuts is on those community services, which is where the people who are dealing with stigma or isolation need to access through community services. So the online is one, but they've got to be resourced to do it.
Maybe just to add that, following what Eamonn said, that for young people, a lot of the services need to be supplied or conducted through other young people. So that's where behavioral change can happen. We're looking at being able to impact and make behavior changes through some of these online apps, etc. Those are, one of the things would be that some of these more obvious hooking up apps can have interventions, advertisements, etc., etc. But then there are some other apps that are more privatized and less able to have those behavioral change programs or be able to reach people more effectively. So that there needs to be a better sense of being able to have young people themselves lead these programs for behavioral change amongst young people to be able to change the behaviors more sustainably.
Okay, thank you. We have another question, is actually from the same online viewer who asked the first question, but she has a different name now. This is from Florinda Corpus.
Keiko. We know it's you, Keiko.
Editor-in-chief of the Filipino-Japanese Journal. She asks, Japan has one of the lowest HIV infection rates in the region, but experts say stigma still prevents many people from getting tested or treated. What lessons can Japan share with its neighbors, and what more can it do to address stigma at home? This is kind of put this a slightly different way. In light of the AIDS crisis in the Philippines and other neighboring countries, how can Japan play a stronger regional role beyond financial aid?
I would actually challenge back on that. I think Japan could be one of the countries in this, and should be one of the countries in this region, that shows that you can end AIDS as a public health threat. But it hasn't. And that's partly because of some of the systemic and historical issues. To get treatment today for HIV, you have to have a certain level of illness rather than same-day test and treat. So there are major challenges that the Ministry of Health needs to unblock. So sorry to challenge Japan in that way. Stigma and discrimination is still a major issue, right, in this day and age, and that's where I know for PrEP, for instance, Japanese will import PrEP from Thailand rather than go and get it here, both for cost but also for the protection of identity. It's the same issues we see in Singapore and some of the other countries, South Korea. So there are still major barriers, and these are programs that you can't address through the mainstream services. That's why the community is critical. That's why the issues of stigma and discrimination need to be invested, not just clinical services, because people are not accessing them. And so Japan could be one of those countries, and should be in this region, with the resources and the capacity it has. We have some of the world leading academic experts on HIV come from Japan. Yet the program here, we shouldn't be even saying that question. It should be not a public health threat today. And so it needs domestic investment as well in the program. And we could say that for some of the other advanced economy investors and contributors to the programs. They've got to look at their own programs as well. We have good examples, but PrEP is critical to that. And we've seen that in Australia. We've seen that in other countries like Thailand, where they can bring the numbers down. So Japan could equally lead in that way.
Anybody else have anything to add?
I hope nobody revokes my visa for that. But
Well, I would like to say Japan has really been a leader in terms of regionally supporting many different global health and HIV programs. So if you look at Papua New Guinea, if you look at Fiji, if you look at other Pacific Islands, I think Japan has played a critical role. And so given these long sort of enduring collaborations and partnerships, I think Keiko's point about thinking about a stronger regional role beyond financial aid, this is exactly what we should be doing, thinking outside of the box, that we're all here together in Asia. How can Japan leverage its unique strengths and regional networks to do more? So I think I agree that more needs to be done, and that Japan really has a unique role and a unique opportunity to push forward this agenda.
I think Eamonn touched a little bit about discrimination. I mean, it's really privileged for that people can travel to other countries for treatment, but also sometimes, just to add, that it's also an opportunity for more partying, because Thailand is known as one of the centers for those parties. But that being said, it does actually show that the world is more interconnected and globalized more now than ever, and there are and that this is why it's really important to ensure, this is one of the rationale and reasons that not only because we want to ensure that our borders are safe, but we want to ensure that it's not about only keeping our own borders safe, because it's actually making sure that everyone else is safe at the same time. So Japan has been in the forefront, a huge supporter of multilateralism, and I think from communities and civil society's perspectives, that is really, really appreciated, and we're looking forward for Japan to be able to not only financially, but in many of the countries where Japan has a presence in terms of the embassies, be able to work better with communities and civil society, providing technical support and expertise, and building partnerships for innovation. I think that's really important role that Japan can play, not only besides financial resources.
On the support, Japan, with its agenda around UHC, is critical in this region for the issues of sustainability. And that can't be underplayed. Before COVID, JICA, with Japanese support of other partners from Japan, were working with us, Thailand and others, on the whole issue of integration. And then COVID disrupted the programs. We call it sustainability today. But this is where I think with a new UHC hub that Japan's going to establish, this is critical to make sure that what you'd call the siloed programs, if you like, TB, HIV, are integrated into that, and to help other countries see how they can unlock the combined efforts around these public health issues, so that we don't continue some of these siloed programs, because they do take away from the collective resources that can be shared. Data, a whole range of programmatic and system issues are common to the diseases, yet often developed in parallel rather than collectively. So Japan has a critical role there. The supplemental budgets that they provide aid through at country level can go straight to the national programs that are needed and the community programs. There's a number of ways Japan can do it in this region, their own region, to invest, and then look at other parts of the world where they also have interests. Thanks.
Eamonn, you just mentioned some sort of hub. Can you explain that a little bit?
I can touch on it, but I can't. I've got a meeting tomorrow actually on this issue because it's under development. But World Bank, WHO, working with Japan, will be looking at establishing best practice around universal health coverage. It means different things in different places. Sadly, in many, it just means biomedical responses, right? And that, as we just discussed, is not sufficient. So how do you integrate into a universal health coverage approach the other programs that will help you have the success you need through your biomedical interventions? We can't treat our way out of any communicable disease. So, but it's unpacked. There are others here who would know more about it, but that's where we're looking at how to partner the related issues, but they're establishing, and again, this is where Japan's at the forefront and leadership in public health responses, and this one is critical for the sustainability of communicable disease and other programs. Thanks.
I'm sorry, what is it? What is the name of the hub?
It's called UHC for short, but universal health coverage. How do you get health insurance programs going? And we have good examples. That's why Japan was partnering with Thailand on this, where Vietnam, Thailand invest their health public funds through insurance for people with disease services that like treatment and other prevention services in both of them, and even fund community organizations. So Japan has a lot of experience to share in this and expertise, and so they're setting up this hub to as a learning process for other countries to see what can be done in their setting.
So this is an initiative which is just being worked out now.
Yes, that's right.
Right. So Japan really is stepping up, at least in
really
some ways.
Stepping up in that, but then we need to see the learning applied at country level.
Right. In terms of one-line interventions, I think South Korea has to be one of the most highly online societies in the Asia Pacific. Is there anything coming out of South Korea that addresses this issue?
Are we referring to the donor landscape, or sorry?
No,
can
I
you be
was
specific on the question?
online interventions, or education efforts. awareness efforts that are done online. So my impression is that South Korea probably has the highest rate of being online of just about any country in Asia.
It's a good question. I think because South Korea doesn't have as big of an HIV epidemic as the Philippines or other countries in the region, there hasn't been as much focus on digital HIV interventions. But within Asia, there certainly are good examples. In China, there's been a lot of exciting crowdsourcing research using phone-based, using phones to organize open contests, and randomized controlled trials have demonstrated that these approaches are effective. And I think in many ways, this is the next frontier of HIV prevention. How can we bring prevention into people's pockets and cell phones? And there's a lot of work that needs to be done in this area.
There are plenty of examples of small-scale initiatives. Vietnam, through Lighthouse, has the young people to young people connection, and they found 20% more people to get into testing who had never been tested before, just in Ho Chi Minh City alone. India, a number of them have really good programs, example programs, and I use that word particular because it's scale. It's the same with PrEP. We only have 4% coverage of this scientific innovation to prevent HIV across this region. It's getting programs to scale. But take out HIV and talk about public health, and governments are not investing enough in this area themselves, right? So it's still fairly traditional community awareness campaigns rather than more targeted approaches through community partners who can really reach people with a whole range of issues, not just HIV. So we are at the cusp of this change. AI is going to make a significant impact in this for service delivery, but it's still early days. And that's where investments by countries like Japan to show the way for public health is going to be critical for all our programs.
I think just to add that there are many countries in the region that have very specific social and cultural norms that can be conservative. South Korea is one of them. HIV is seen, I mean, not only HIV, but same sex is actually a hugely stigmatized issue in South Korea. And because of that, people don't, Eamonn has pointed, people travel to other countries from South Korea for treatment, for example, even for testing. This still happens in many of the developed countries across the region. This probably is something that needs to be looked more effectively upon in terms of innovation, in terms of how people, as you pointed out, being most online, but being most online on doing what? Because a lot of people, young people in China, for example, China has the highest number of people, just basically purely because of its population, over 1 billion people that's online most of the time. But what apps are they looking at using, and then how can you actually have related services targeted for these users is more important.
Okay, we're coming up on 12 noon. Do you have any questions from anyone here in the room? Okay, any last closing statements you'd like to make?
I think we're at a critical inflection point right now in 2025. There's a lot of turbulence, and we need to keep our eyes on the prize and continue investments in HIV, continue to listen to our communities and listen to the partners that we've worked with for so long. We're close to an AIDS-free generation, and we can do more. We have to do more to make this happen. Thank you.
I think Joe said it. We are so close in many places, and now we're sliding backwards at a too faster pace. So now's not the time to step back from the common agenda, because the common issue is, and common risks are going to be the impact in all our countries. So thank you for the interest, and we hope to see Japan continue and push other countries in the region to also step up, not just for Japan. Thanks.
So I think I just want to add that in 5 years' time, that that would be the end of the current SDGs. Some of us would have lived through the Millennium Development Goals, and now it's the Sustainable Development Goals. And I think it's actually looking across 30 over years in terms of the response, and being able to see that while we have been able to support some countries in terms of the health systems, there are many things that are systemic that need to be addressed to be able to move things forward more rapidly. So things like supporting countries with enabling legal environments for key populations and decriminalization, which helps with stigma and discrimination, or reduce stigma and discrimination, is more important alongside some of these efforts that we are talking in terms of financial resources or behavioral change.
We just got another question from an online viewer. This comes from Rocky Swift of Reuters. He says, Japanese pharma company Shionogi is one of the major global makers of HIV and AIDS treatments. Are you in contact with them on how to improve treatment access? I don't know if you can tackle that question or not.
Treatment access is usually not by the drug maker, it's more at the program level in countries. So, but the major pharmaceutical companies that produce the drugs do work on partnership, and conferences like APACC, which we're all here in Tokyo for, these are where they share the innovation and learn from what programs they need to support. So there's corporate social responsibility programs that they and others are part of, but it's different. You've got to work with the systems in country and then get the prices down. And so these drug companies are producing the new long-acting injectables, which are going to have unbelievable positive impacts on getting us to that end of AIDS as a public health threat, are working through the process of how to get prices down. Again, this is where the loss of the US technical and financial support in these programs is so shocking for us, because we were so close with that. And this is where Japan can help in this area, help negotiate these prices, get the right programs with the pharmaceutical companies as partners, and we can make an impact globally and particularly in this region. Thanks.
I just want to add, it's not just about bringing the prices down, but it's countries can also look at actually using TRIPS flexibility to be able to support countries that actually do need access to the drugs to be able to access them more effectively.
That's the country, not the drug company.
Yeah, that's the country, not the drug company.
Okay, on that note, we will end the press conference. Thanks to Joseph Tucker, Eamonn Murphy, and Rachel Ong. Thank you very much for coming back today. Thanks to all of those who are watching online and those who came in person.